Good morning, everybody, and thank you so much for coming bright and early on a Monday morning, right at the start of the week. I'm Laura Kittle-Kahn. I'm a senior scientist at CDC, but relative to NCCOR, I'm on the steering committee, and what I wanted to do before we even get into the content of today is give a little bit of background on NCCOR and what it is and why NCCOR has been playing such a vital role in this workshop series. For those of you who don't know NCCOR or are not familiar with it, it's a partnership between the Robert Wood Johnson Foundation, USDA, CDC, and NIH. And our NCCOR stands for the National Collaborative of Childhood Obesity Research. And one of the primary objectives of that partnership is not just to focus on the research agenda, but what it's more a more comprehensive look at the research agenda and the evaluation needs. And so we try to bring practitioners in and learn from the field to move the research agenda. And today's meeting in particular, as will be described, is we've had this series, like the first, second, and then this third meeting. It's really going to be a conversation. We want your input about this is what we know from the practitioner side, this is what we know from the researcher side, and then what do we do with all that information and how do we move it forward? And so there might be roles for NCCOR in particular, but then you, in your own individual role in your own work, may recognize specific things that you could do as well in terms of coordinating all this. Without further ado then, unless somebody has any questions about NCCOR in particular, yes, no, nah? I'm going to start off the first panel. Do we want to get everybody up here first? So can the discussants, and then is Joanne or Lisa, are you, there you go. Come on up. As Elaine mentioned earlier in her remarks, this particular session, because not everyone was able to participate in both the first and the second meetings, is going to give you a little recap of each of those workshops, and then have Lorelei and Kate be reactants or discussants from it. And please, for those of you who were able to attend one or both of the other workshops, I mean, these are going to be very short synopsises, and we might have missed something that you thought was really, really critical. And so please do not hesitate to bring it up and get that as part of the conversation. So I have been charged with giving an overview of the first workshop. Let's see. Can I do it that way? There we go. And I would be remiss if I didn't recognize the committee members that worked on planning this workshop series. They have done extraordinary work in a very short amount of time. But then Adi, where are you? There you are. And Jordan, who I think is probably sitting outside at the front desk, as the staff from the Coordinating Center for NCCOR have done extraordinary magical things in the background to get this all to happen. But as you can see, the committee is quite diverse, and we'll move on from there. Okay. Just some background on the whole entire workshop series before I dive into the first workshop in particular. The first question is that most people ask is kind of how did this happen and why? We decided that we needed to hear from and align all the interests of the various practitioners, researchers, as well as funders and other stakeholders. And what was very coincidental, about February, early March of this past spring, the individual partners within NCCOR recognized that each of us, independently of each other and in our own little silo, was starting to have conversations and work agendas related to healthy food incentives. And when we realized that, we said, ooh, we're missing an opportunity here. And so that's how it came together. So the first workshop we had was perspectives from the field, so it was mainly the practitioner experiences and perspectives. The second was specifically focused on the ways to nudge SNAP shoppers in making those purchases, and it could either be financial incentives or promotional incentives, placement within grocery stores or farmers markets, and to look at the research and evaluation experiences that folks are aware of currently. And then third, today's workshop is trying to synthesize all that in moving the field forward. And we're hoping to summarize all that wonderful information and give people some action steps at the end of the day. Okay. Actually, I think I've said most of what is in this slide in terms of purpose and goals. So just for time, we'll go forward. Okay, workshop 1. As I mentioned, it mainly was from the practitioner's perspective, including best practices and barriers in implementation as well as policy concerns. One of the, what was interesting is a lot of the work that's being done out in the field is in farmers markets more so than grocery stores, so we need to keep that in mind. The audience of the workshop were practitioners, including those from nonprofits, state and local health governments, or departments, excuse me, and then food industry as well as agricultural organizations. The primary lessons that we learned that came away from at the end of the day were that the financial incentives definitely attract new clients to farmers markets, but it really, it's written here that it's not in groceries. It just hasn't really been done very much in grocery stores, and so we don't know if it would be as effective. And very few non-financial incentives have been implemented in farmers markets or grocery stores. And if they have, they're often not associated with researchers, so the results of those experiences have not been documented or disseminated, and so that's one of the gaps that we're realizing. And then the feeling in the room for Workshop 1 was that it was a wonderful opportunity and appreciation just for the time to gather as a field, because it just really hasn't happened up until now or more recently, and a strong desire to form some kind of a learning collaborative or community, and NCCOR can probably take that on as one of the facilitators of that. Okay, implications for today's discussion. I think that and these were totally from my perspective, and so as I mentioned, if something else struck you, please chime in. How do we connect practitioners with researchers so the results can be shared to build the evidence base was key for me. What would motivate retailers, especially grocery store owners and farmers, to collaborate with researchers and document the impact of their incentive programs? How do we or should we adapt what has occurred in farmers markets into other retail venues such as grocery stores, and do we do it in exactly the same way, or is it slightly different? Is there a value or a business case for non-financial incentives? How can or should financial incentives be sustained and funded over the long haul? Because that's a key question on folks' mind. And then what sectors have been most engaged in providing healthy foods incentives up to this day, and what is the attraction, or why have they been engaged in that effort, and what's their what benefit do they get out of it? Okay, that's for Workshop 1. Joanne, do you want to do Workshop 2? And actually, before we go to Workshop 2, were there any other big lessons that people learned or take-home summary statements that they think we should have shared from Workshop 1? Okay, there you go. And it's obvious, just the little arrow.
Okay. Well, we hope the little arrow thing works for me. Okay, I'm happy to speak about Workshop 2, exploring ways to nudge healthy purchases among SNAP shoppers, brief summary, some reflections, and it's only been a couple months, so the moving forward isn't necessarily huge new statements, but something about what we've been doing since then. And I want to acknowledge my partner in planning the workshop and this presentation, Lisa Mancino, my colleague at ERS. I don't think I have to say to this group very much about why we focused on SNAP participants. I think people here know this is a hugely important program serving more than 46 million people per month. There's a strong body of research that shows it is very effective in alleviating poverty, especially among households with children, and reducing food insecurity. Unfortunately, the research is not as positive on diet quality. Most research, including some of the latest research that does the best to adjust for selection bias and other important factors, shows very minimal effects on diet quality. So here clearly is an opportunity, given the influence it has on the purchasing habits of so many Americans. And we have to ask ourselves, how can research support this program in improving the food choices, diet quality, and health of so many Americans? And this, again, obviously supports the President and the USDA's desire to have more evidence-based policies and practices to advance our programs and make them more effective. Okay, wait a minute, sorry. Okay, now I'm going to talk about behavioral economics because that was really how we organized our thinking. Behavioral economics has become a bit of a buzzword, and I think a lot of people know, at least in general, it unifies ideas from economics and psychology to try to get a better understanding of consumer decision-making and promote healthier choices. Some people say, well, how different is this than marketing? Maybe in some ways it's not, but one way I think that they're both importantly unified is you have to start by knowing your customer, knowing your person. And we started out by talking about the challenges faced by SNAP participants, a data-driven approach using USDA-funded data like the Flexible Consumer Behavior Survey. And we found, let's look at these people. As a group, we found that they value nutrition as much as other consumers, but they have other constraints that also impact their choices, and we have to be aware of. Perhaps because of their life circumstances or other factors, they're more pessimistic about the value of making dietary improvements. They began possibly because of factors in their lives, they're more likely to shop infrequently and may have a harder time getting to the store. And generally, time and money complicate the task of making healthier food choices. So here we have a group that, just like everybody else, would like to be healthy, but they have some barriers. So what do we do about this? How do we think about this? We thought that behavioral economics might be a way to make healthy food choices easier for SNAP shoppers. So the workshop was about exploring the application of behavioral economic ideas to helping SNAP shoppers make healthy, economical choices, making this easier, making this more automatic. As I said, behavioral economics brings together strands of research from economics, from cognitive psychology, and from other fields to examine what traditional economists, with their assumptions of pure rationality, like we're always at all times these wonderful consumer report-driven consumers who always make the best choice, would find to be errors in judgment. We might say, well, why do people who value health, and who doesn't value health? Would any of us want to say, oh, I want to be sick? No. But why would they then make an unhealthy food choice? Because perhaps there are short-term goals like tastiness or convenience or something else that also intrude. And we find that the proximity of the choice, the way the choice is framed, influences the decision. And that's a key insight. There are many others, of course. But it leads us to think about, well, how can we make that choice easier, more automatic, more the one that's in front of you? How can we help people to avoid those errors? And a common way of referring to that has been, how can we change the choice architecture, the environment in which people make choices? I mentioned A little bit about how we can use this idea to understand consumer food choices from a behavioral economic perspective, and that was a theme in our meeting. We talked about this issue of present bias preferences. Yes, we want long-term health, just like we want a long-term happy retirement and other good things. But in the here and now, we may want to eat the tasty foods, spend the money. How do we balance that? How can we frame that? And we looked at how this could be influenced by things like defaults. Do you automatically get the French fries or the salad with your sandwich? With the ease of making one choice versus another, with the proximity. What do you see first when you go through a cafeteria line, perhaps? By visceral influences like hunger, by stress, by distraction. And many of our speakers at least alluded to important work in related fields like the work of Sandil Mullainathan and Eldar Shafir on how scarcity influences people's choice behavior, which I think is a really salient insight when we're dealing with low-income consumers. We looked at how people use rules of thumb and mental accounting to simplify decision-making. Obviously, people don't want to spend hours in a grocery store looking at every package. They come up with these rubrics. Do they work for them? Can we find better rubrics that work better for them? So those were interesting insights from the consumer perspective. But to make this work in a free society, we have to take into account the supply perspective also. So we also looked at issues around that topic. Healthier packaged foods. How can those become more commonplace, easier to acquire? We looked at retail efforts to align with health that we're seeing in some different kinds of setups. What can the retailer do in terms of offerings, in terms of layout, in terms of additional services like supermarket dietitians and so forth? And what would be their incentives for doing so? And then we looked at some existing programs geared to the low-income consumer, and often the SNAP consumer as a large share, at any rate, of those consumers, and how they could perhaps be brought together with some of these behavioral economics insights to influence their effectiveness. So we had speakers from groups like Feeding America, Share Our Strength, SNAP Ed, other groups talking about nutrition and food skills education, making food pantries healthier, using technological innovations like mobile phone apps, social media, online shopping, using in-store marketing. This is a little visual from one of our speakers who, put out these arrows in a store, follow the green arrows for healthy, I think, weight, healthy diet, something like that, leading people to the produce aisle, guiding them through it, gentle nudges, and community promotions, and generally changing social norms within a community, which is something that SNAP Ed in California was working with retailers in low-income areas to do. So this was our program. And as far as lessons learned, we came out of it, I think, feeling, at least hope some of us, and I guess we can have a dialogue about this, that behavioral economics has potential for developing strategies that promote healthy economical food choices while continuing to allow freedom of choice, and that these strategies had the potential for other factors that are important to us. Of course, that they be effective, that they have reach, that they serve, because SNAP is a diverse constituency. We have working poor, we have disabled, we have elderly, we have children. What is the reach across the SNAP population? That they be feasible in various settings, and with existing program regulations, or with modifications, I suppose, that might be considered reasonable in a given political climate, and that they would be scalable, that they could be taken to a level where they go beyond being an interesting pilot, but have actually impact on an appreciable share of these 47 million people that participate in SNAP each month. We believe that to be successful, the strategies must be acceptable to both the supply side stakeholders, like the food manufacturers and retailers, and to consumers. And that, obviously, we always say this at the end of a research meeting, right? Research is needed to identify these possible strategies and field test them for these qualities and their effectiveness within the range of SNAP customers and retail settings. So that was my takeaway, and again, as Laura was saying, there's going to be discussion so other people can chime in on their takeaways. As far as moving forward, what have we done since then? What are we planning to do? Now, this is, again, is the USDA perspective. Other people will have other perspectives. We feel that there needs to be more investigation of SNAP participant food choices and the factors that motivate them. We're going to continue to make use of the Flexible Consumer Behavior Survey, which is a module that we paid to have added to NHANES so that we can look at choice and health and other factors. And we're going to be making use of the National Household Food Acquisition and Purchase Survey, which we call Food Apps, which basically is a large-scale survey of almost 5,000 households with an oversample of SNAP, where they shop, when they shop, what they buy, what's its nutrient profile, what are some of the relevant knowledge, attitudes, behaviors. We're going to be pulling this together to address questions about what about store access? What about time spent shopping? What about the bundle of foods that different kinds of SNAP customers buy, and what the bundles that they buy in one venue versus another? And many changes like this. And this is something that we're very excited about at USDA. It was a partnership between FNS and ERS, and we're very excited about continuing to do that. We're working on some products, some publication products related to this topic. We have an ERS article that is in preparation right now about some of these issues, and a longer report that we will be working on also as kind of a white paper on the topic. We have in the works a cooperative research agreement between ERS and Colin Payne and Mihai Niculescu at New Mexico State University. They're the researchers with those arrows that I showed you in the slide. They've been doing a lot of exciting things in retail and low-income consumers in the southwest part of the United States, a very high-needs group, and we're excited about working with them on some field experiments. And we posted, as we mentioned actually at the last workshop, an RFA to establish a new USDA Center for Behavioral Economics and Healthy Food Choice Research, which it will be an amount up to $1.9 million over 3 years, and we hope will be a hub, a foundation, a center for more research in this area. And we hope to be able to announce where that center will be and who will be leading it within the near future. And we were also excited at our workshop that other partners expressed interest in more research along this line. We feel that this is a very important area, that there is a lot of room for work to be done, and that we would really like to be a big part of that whole research initiative. Okay, thank you.